That's a new medical complex for veterans in the Valley is on track to open next year. Congresswoman Shelley Berkley, along with several other officials and about a dozen veterans, toured the Southern Nevada VA medical complex this week. The $650 million project, which is being built on North Pecos near the 215, will include a hospital, outpatient clinic, and long-term care facility. Berkley says this complex will go a long way in helping our veterans here in the Valley.
This facility is going to be the envy of the entire VA system, and it's going to not only improve the quality of care, not only be an economic stimulator for the entire Las Vegas Valley, but it's going to make it so much easier for our veterans to obtain the care.
The medical facility is expected to serve more than 50,000 enrolled VA patients and more than 200,000 veterans.
Nevada's population grew 35% from 2000 to 2010, but that is nothing compared to the growth in our population of residents 62 and above. Their numbers grew by 54%, and the number of people over 85 here grew 78%. Those numbers mean opportunity. One company that is capitalizing on our graying population is local home care company Visiting Angels, which specializes in helping seniors stay in their homes. And I'm joined by Visiting Angels co-owner Michael Diazio. Mr. Diazio, great to have you on our program. Thanks for coming here today. What exactly does your staff do when they go into a person's home?
Our goal overall is to keep a senior independent and in their home. We try to design a program with the families where we come in and do tasks that have become challenging for the seniors. That can range from first thing in the morning, such as helping somebody get out of bed and into the shower, dressed for the day, all personal hygiene, making the meals, whether it be breakfast, lunch, dinner. We also do such things for them as late housekeeping. You know, even something simple as running the vacuum cleaner gets to be a challenge for an elderly person. So we do late housekeeping. We provide transportation because driving, you know, can be an issue, or we simply run errands for them to pick up medications or bread and milk, that kind of thing. We've been doing a lot of companionship, socialization, as well as, you know, things like walking and getting them exercise out and enjoy the beautiful weather we've been having.
How have you seen, I mean, we had the numbers about our population here of people over 62 really growing. How's your business grown because of that?
Oh, we've grown dramatically over the last year at 18 months, well over 40%. Now that, you know, we are in a recession, and that has not come without hard work on our part and being, you know, trying to be responsive to our seniors' needs in this recession and being flexible with our programs, and they've responded. And naturally, you know, you have to have good employees who go into the homes each day and take care of mom and dad.
Now, I mean, when you say responsive to a recession, that gets back to pricing. I would imagine that something like this, I mean, home care isn't cheap. How are you able to compete in a recession? What have you done with your price points?
Yeah.
Essentially.
You know, it's and that's a question we get really as every new client calls. The price per hour we've dropped. You know, it's right around $20, and we've dropped below that, so we're below the market. But the second part of that question is what is the minimum hours of service? And most agencies, or the industry norm, is 4 hours. So a family would be spending a minimum of $80 for each service. We decided to cut that all the way down to 2 hours. So hence they would only be paying $40 or saving 50%. And in a lot of cases, that's all they need, you know, to, for example, that morning service to get them out of bed, bathed and dressed, and make them a good breakfast. That's usually when they take their medicine, so we're reminding them to do that. That has been very, very popular. We're essentially saving them 50%.
Do you find that most of your clients need your services? Is it generally a 7-day-a-week commitment to you, or do you find that your clients, in order to cut back, maybe have you come in 3 days a week and a family member fills in the other 2 days a week? How is that working?
Yeah, you know, there's no real contract to our service. We're extremely flexible. We even, for example, have families that use us, you know, when they go on vacation and somebody needs to step in and take care of grandma or grandpa while they go on vacation, even for a weekend. But they don't generally, Monday, Wednesday, Friday, for example, every alternating days is common, but it's more frequent that they have us come in every day, but they enjoy that 2-hour minimum. Which we've also, took that one step further and said, for those clients who need 12 or 24-hour care, we come in multiple times a day for 2 hours, maybe breakfast, lunch, dinner, maybe bedtime. We try to surround it around the times that we can be of the most value to them.
We're at a time, obviously, more people will be needing your services. Mr. Diazzo, we appreciate your time today. Thanks for coming on our program.
Thank you for having me.
Dana.
Thanks, Jeff. The battle over those so-called slot arcades is just beginning. A second chain joins Dottie's in its fight against Clark County, and casinos make their case to the state. Plus, an effort to weed out quacks could put alternative health providers under the watchful eye of medical doctors. We'll tell you about it when we come back.